Welcome to this module on the skin, the largest organ in the body and also the most important, or the one that we are connected to and the medium through which we work as a hands-on manual therapist. Although we may be looking to impact someone's nervous system, their muscles, their joints, it is through the skin that we communicate with our clients' nervous systems. So understanding a little bit more about the skin and what it does, the functions it serves, that will help us to understand how we use it and how we affect our clients. We'll also look at common pathologies of the skin, red flags and things for you to look for if your client's skin is not in the condition that we need to be able to work with it. There are 6 main functions of the skin: protection, temperature regulation, excretion, sensation, secretion, and also the formation of chemicals. So let's look at protection first. As I said, it's almost like that sac, that outer covering of our body in which all other organs sit. It, in the first instance, acts as a barrier to the invasion of things like organisms and bacteria. It is naturally acidic in terms of pH, which inhibits bacterial production. It also contains melanin, which is a pigment produced by the melanocytes in the basal layer of the epidermis, which helps to protect us against the UV rays in sunlight. It also contains sensory nerve endings. These send warning signals on things like too much pressure, heat, cold, that our nervous system can then allow us to take actions like remove our hand from the hot pot. So it has many protective functions. Next, it's involved in temperature regulation, the obvious one being heat. Heat is absorbed and maintained in the subcutaneous layer of fatty or adipose tissue beneath the skin. But also, the skin, in that middle layer where it's vascular, when the body becomes hot, those capillaries near the surface can vasodilate, allowing more blood to reach the surface of the skin so that we can release that heat from the body. Sweat is secreted, and this evaporation of that sweat or perspiration on the surface has a cooling effect on the body. But it's not just about regulating our temperatures when it's hot. When it's cold, those very same capillaries vasoconstrict, so that blood is moved away from the surface, away from the extremities, and directed towards the major organs to keep them warm and keep us alive. So our skin appears pale. Heat loss is inhibited when we are cold, as opposed to that flushing, that redness when we're hot and when the capillaries vasodilate. Excretion, so this comes back to that sweat. So as we sweat, we're releasing excess water, salt, and also some toxins through those sweat glands on the skin. Sensation, probably the most important function, or the one that we're targeting with our hands in manual therapy. There are specialized nerve endings found in the dermis, and they make the body aware of its surroundings in terms of heat, cold, pressure, touch, different types of touch. Different types of receptors lie at different levels in the skin. Pain or touch receptors are close to the surface. Pain is an output from the nervous system and brain, but it's due to the inputs in terms of what is picked up by these receptors that can determine what is output from the brain. So again, our pressure, that will have an impact on someone's nervous system and whether or not it creates a pain output. Something we'll look more closely at when we talk about pain science and the nervous system. Secretion, so different here than sweat. This is where we also secrete sebum or oil from the sebaceous glands. This fatty, oily substance lubricates the hair shafts, and when combined with perspiration on the surface, it creates a natural moisturizer which helps create that protective barrier of the skin, as well as to protect the skin itself. Different people, different levels of secretion. Oily skin, where there's high levels of secretion, and dry skin, where they're lower. Finally, the formation of chemicals. Vitamin D formation. This is essential for the formation and maintenance of bone, working with calcium. but it is stimulated by UV light, which converts a fatty substance in the skin into vitamin D. This vitamin D circulates the body via the blood, and excess levels are stored in the liver before being eliminated. Also, the body makes melanocyte-stimulating hormone, or MSH, and this causes the melanocytes in the basal layer of the epidermis to produce melanin, that substance we talked about which produces a darkening of the skin to protect the underlying structures from UV light. So the skin does a lot more than you may have originally thought. But let's look at the structure of the skin to understand what the different layers are and where the various functions sit within those layers. So let's look a little closer at the anatomy of the skin. And we're going to talk about the three main layers. Firstly, the most superficial, the epidermis here. So that's the skin that we'll be in contact with as a massage therapist. We then have this thicker or denser layer called the dermis. And under that is that subcutaneous tissue where the adipose or fatty layer is contained. So let's take a look at the epidermis. There are 5 layers in the epidermis. So let's start with the most superficial, the stratum corneum, this horny cell layer, which is made up of dead skin cells. So that's what gives it that tough outer protective quality. The second layer, also made primarily of dead skin cells, but this has a clear appearance, and this additional layer of skin cells acts to help reduce friction between the layers of the skin. It helps to reduce the friction from those shearing forces that are applied to the skin and its layers. We then have the granular cell layer, or the stratum granulosum, and this layer contains the oils that help the skin remain watertight. So again, a protective layer. We then come down to this thicker layer, the squamous cell layer, prickly cell layer, stratum spinosum. So that spiny, prickly name, that comes from the spine-like projections of the cells in this layer. And those projections help give structural reinforcement to the skin. And that's what helps to provide the strength and elasticity and the flexibility that we see when we apply shearing forces to the skin. It doesn't tear, it bends, it ebbs, it moves. So this helps to provide a lot of that elasticity that we see. And finally, we have the stratum basal, the basal cell layer. This layer is primarily made up of basal keratinocyte stem cells, and they can be considered the stem cells of the epidermis. There are a number of other cells found in this layer, including pigment-producing cells, immune cells, and even some touch receptors. Now let's look at the dermis, that thicker layer underneath the epidermis. So, unlike the epidermis, as you can see, it contains a lot of blood and lymphatic supply. This allows it to provide various functions. For example, delivering nutrients to the skin, to help regulate body temperature. And having that lymphatic supply also helps to fight infection as part of the immune system. It's mainly formed of collagen fibers, connective tissue, and elastin, in which those lymphatic and blood supplies sit. Also, you'll see here, although the hair appears and projects out from the epidermis, the hair root and the hair follicle itself sit within the dermis. The oil glands, the sebaceous glands, are also contained in this layer, which produce the oil which keep the skin and hair protected. The sweat glands are found here, and they help with the excretion of the waste salts and waters, and also help to keep the skin cool in terms of heat regulation. Sensory nerve endings are found here, relaying information on things like pressure, heat, cold. Dermal papillae nourish the hair on the skin. Collagen and elastin proteins create that strength and elasticity and flexibility in the skin as well. So along with those layers in the epidermis, we have a much thicker layer of connective tissue in the dermis. But we also have little muscles that are contained here. The erector pili muscle attach to each hair follicle, and when those muscles contract, make the hairs stand on end, very much like when we have a goosebump. So let's talk about the skin and its connection to the nervous system, as this is really the key or the medium that we use with a lot of our manual therapies. Although we're touching the skin, often our intent or our goal is to have an effect on muscles, joints, range of motion, pain levels. This is not achieved mechanically through touch, but rather we use that touch on the skin to stimulate and send messages to the nervous system to change the output from the brain. The skin is supplied by autonomic nerves, so those subconscious nerves. They innervate the skin, blood and glandular cells on the skin. There are a large number of sensory nerve endings, sending messages to the central nervous system for processing. So for example, taking inputs from heat, pressure, etc. The number of receptors vary. For example, there are more on the face and the fingertips than there are on, for example, the legs. And again, this comes down to that protective mechanism. We feel more with our fingers. We need to protect our face more. So again, they send more messages so that our brains can protect us where threat exists. The skin is served by nerves that come from many different parts of the spine, and the area covered by each segment of the spine is called a dermatome. You will often see images of the various dermatomes and where the parts of the skin relate to a part of the spine. So let's talk about pathologies of the skin. You will come across many of these in treating your client population. So it's really important that one, if a client declares they have a condition, you know what the impact is for your treatment. And two, to help you recognize. Sometimes you will see parts of your client's skin that they themselves don't see. So it's important that you recognize any conditions so that you can make them aware where they need to perhaps see a GP or be referred to a skin specialist. So first up, let's talk about eczema. Recognition points. Sometimes reddened skin, sometimes thickening of the skin, itchiness, flakiness. It can be in patches across the body rather than being uniform. It can also bubble, blister, weep and crack. So in terms of impact, we can absolutely massage someone with eczema, but it's a local contraindication or modification. Any open cut, open sore, open eczema would be a local contraindication, as we don't want to bring a risk of infection to the area. Also, you might want to check with your clients about what might aggravate their eczema. It's really important that the products we use are natural, safe, and also don't aggravate any of the skin conditions your clients may have. So please discuss mediums with your client to find one that they know is safe for their condition. Psoriasis. This is where we see patchy lesions with a scaly appearance. There could be redness, flakiness, dry skin. Again, a local contraindication or modification. This depends on the severity of the psoriasis. For example, with simply flaky dry skin, the client may feel no pain, there may not be no redness, no inflammation, and you can work through a towel or with selected mediums on that skin. But if it's inflamed, red, any cracking, any open sores, then again that becomes a local contraindication. Contact dermatitis. Here we might see reddened patches of the skin that may burn or blister. Generally, it's found on the hands, wrists or face due to things like washing the hands a lot. You often see this in new mums who are washing baby bottles a lot. Look for where this dermatitis is, ask your client what aggravates it, and again, treat it as a local contraindication. It's good to get an understanding of why or what has caused the contact dermatitis for your client, as it may give a clue to products or mediums that might aggravate them. Let's look at bacterial pathologies of the skin. Acne vulgaris. So here we might see blackheads, whiteheads, or inflamed red spots or pustules. When inflamed, these become a local contraindication. Impetigo. This is where we see fluid-filled blisters in the yellow crust. This is highly contagious, so is an absolute contraindication, and you shouldn't treat your client if they have impetigo. Folliculitis. So this is where we see red pimples with a hair in the centre of each one, where the hair follicle has become inflamed. Sometimes these can also fill with pus, so you may see a yellowness to those red pimples as well. Avoid the area, it's a local contraindication, but you can work on the areas of the body that do not have the folliculitis. Boils. This is where there's an infected hair follicle or oil gland. There may be pus or signs of infection. It's a local contraindication, as again we don't want to introduce infection into the boil. They can be slow to heal, and we want to ensure that we do not affect that healing process. Let's talk about some viral conditions. The first one, ringworm, Tinea corporis. This can be a red, itchy, raised circle that looks like a worm buried itself into the skin. It can also be itchy, flaky, painful, and possible hair loss around the area. Depending on the size and also the location of the ringworm, then it can either be a global or local contraindication. It is infectious, and we don't want to treat the ringworm, we don't want to touch it, we don't want to inflame it, we don't want to risk infection. But two, we also don't want to spread it to ourselves or our clients. So it's important we find out where the ringworm is, how large it is, and whether or not it can be treated as a local contraindication. Then we have athlete's foot, which is more common, Tinea pedis. Mushy skin on the foot, cracks between the toes, flaky red skin, itchy, it can be quite painful. Given that it's on the foot, it can generally be treated as a local contraindication. If your client declares they have athlete foot on your screening form, then please ask them to leave their sock on during treatment. You can still work the foot if it's not inflamed. Although you won't be looking at it as the sock is on, please discuss with your client if you're doing any footwork through the sock. Techniques like STR, MET are wonderful for affecting the range of motion of the toes and foot without having to work directly over the area. So again, local contraindication, and modify how you treat. Pigmentation disorders. Vitiligo. This is where we have patches of skin with no colour or pigment. This is safe and there's no change to your treatments. Albinism. This is where there's a total absence of pigmentation. Again, no impact for your massage therapy. Chloasma. This is where we have dark skin discoloration or melasma. Again, with pigmentation, there's no impact or contraindication. And then we have ephelides, freckles, and these are clusters of melanized or dark cells. No impact for your treatment. Lentigo or liver spots. These are dark patches larger than freckles and can sometimes be raised in appearance. Again, they are safe and no impact. Moles are a collection of pigmented cells darker than freckles and can also be raised. These are safe and there's no impact to what you're doing. But if you do notice any moles that are irregular shaped or that have changed, for example, on regular clients, please do flag these to your client, as again, especially on the back of the body, we see moles that our clients don't. And if you spot changes, please do let them know. There are some really great videos on what to look out for as sports massage therapists with regards to looking for moles and spotting possible skin cancers early. These courses are run by cancer charities, and I highly recommend that you look into doing one just to help equip yourself with the knowledge of looking for red flags, so that if you do spot a mole that looks like it needs investigation, you can simply flag to your client to go and get it checked by their doctor. Neve or birthmarks. These can be brown, black red and present from birth. No impact to your treatment. A port wine stain, this is a permanent purple discoloration of a patch of skin. And again, doesn't change your massage treatment. So some general disorders of the skin. Broken capillaries. So this is where we see fine red lines, usually on the face, but sometimes you'll also see them in places like the inside of the knee, for example. They can be bluish if blood pools as well. It's a local contraindication, as we don't want to break capillaries any further. So light pressure, avoid the area, and don't try any invasive techniques directly over the broken capillaries. UV damage, so this is where the stratum corneum thickens, so that horny cell layer, and it can be hard to tell with the naked eye. Again, if a client reports they have some UV damage, there's no impact to your massage. Hives, urticaria. These are itchy red lumps. These are a local contraindication. Generally, if something's red, there's inflammation, so avoid until it is gone. Allergic reactions. Red, blotchy patches on the skin, watery, stinging eyes, swellings and runny nose. This is a contraindication. If your client appears with an allergic reaction with patches on their skin, then please don't treat your client and refer them on to their doctor. And let's talk about skin cancers. So all skin cancers are deemed local contraindications from the General Council of Massage Therapists. If in doubt, please ask your client to get confirmation from their GP or doctor that they're okay to receive massage given their skin cancer. It is absolutely a local contraindication, so if your client does have a skin cancer, find out where it is, whether it's painful, whether it's inflamed, and whether or not they're comfortable. You may need to modify how they're set up on the bed, for example, to ensure that they are comfortable throughout. Let's talk about basal cell carcinoma. So this is found in the basal, or that deepest layer of the epidermis that we talked about earlier. And this is where the skin develops nodules or shallow ulcers with a raised edge. Squamous cell carcinoma. This is cancer associated with cells in the upper skin layers, and it's more of a swelling type cancer. It may resemble a wart, an ulcer, and it can grow quite rapidly. Malignant melanomas. So this is cancer of the pigment producing cells. Usually develops in a previously benign mole. The mole becomes larger, darker, ulcerated. It can have an uneven edge, uneven, lack of symmetry, and the tumour eventually spreads. So again, important to understand if your client has a malignant melanoma, what stage they are, whether or not it has spread to any other organs, and absolutely I would be looking for GP approval to treat this client. So let's talk about the impact of age on the skin. So not a pathology as such, but there are some general things to note about older skin. As we age, the epidermis thins. The number of Langerhans cells decrease, so that immune element starts to drop. Decreased vitamin D production, the dermis thinning also. So as you can imagine, if the epidermis and dermis are thinning, then the barrier between them is weakening. That elasticity, that flexibility is going to be reduced. The elastin levels start to reduce as we age, again affecting that elasticity. Glandular secretions decrease, so that oiliness, so the skin becomes drier. The melanocytes decrease, and the cutaneous nerves do not significantly change with age. So what can we take from this? We can take that the skin is more delicate, it isn't as elastic, so let's not work it as hard as we might have done before. The nerves don't change with age, so we still need to communicate with our clients around pressure, pain levels, any friction, any heat. So important that we still communicate really well with our client, but that we work slowly, sensitively, and know that we can achieve the depth we need without working the skin very hard. So what does all this information on the skin mean for massage? I think the most important thing here is that we understand what it is we do at the skin level for our clients, how that has an impact on the whole body. So that one slide, that one thing we talked about, where the skin is our gateway to the client's nervous system, is probably the most important thing to take away in terms of what it is we're doing when we touch a client's skin. It's also really important that we go through those pathologies so that you can identify inflammation on the skin or other recognition points like itching, flaking, patching. It's when you need to decide whether or not to treat someone, whether or not it's a local contraindication or whether it's simply a modification. As always, if in doubt, get out. If you're not sure, ask your client to ask their doctor and get some clarity before you treat them. It's so important to talk about hygiene. So we talked about those bacterial and viral elements. So really important. Hygiene's always top of our list between clients. Factoring in age and skin quality. Really important when deciding what techniques to use. We might not want to use such shearing type techniques like STRs, like a firm STR with more delicate older skin. But things like gliding, transverse STRs might be more appropriate. So as always, we're always thinking what technique, what pressure is right for my client. And that starts with your client, understanding them and their skin better so that you can deliver the right treatment for them.